Hello, everybody. Good afternoon. Thank you so much for joining this webinar. I am Kelly Tellos. I am the project manager for the Impact Research Project, and for us, it's. I'm very happy to start this webinar called Illuminate. I don't know, Matias, could you confirm in the chat if we're starting or if we want to give everyone a few more minutes? Okay, so thank you everybody for being here. Today's session is very special for us within the Impact team. It's a session where we're starting with the series of webinars started together with the Impact Project, which is a project addressing several issues that have an influence on care and the way dementia is addressed in people in Peru currently, without thinking of the region. And we have several issues we are working on with a broad team where we focus on diagnosis, on approaching treatment together with caretakers, economic impact, and also on reducing stigma and increasing education on dementia in our country. So this webinar cycle for us illuminates, or what it tries to do is to focus on bringing in experts in dementia, both from our country as well as from the region. And beyond that, we also hope to be able to have more foreign international guests who can tell us about innovations that can exist in brain health. We may not focus only on dementia. We can focus go beyond that and think about the well-being of patients with dementia, well-being of the population that may be at risk of developing dementia, and aging, healthy aging. So we thank you for being here. So we are expecting to have this cycle till the 20th to the 27th. And if you could help me with moving the slides forward, please. So today, as our first, it being the first webinar of the series, we have with us Dr. Marcio Soto, who is going to talk to us about digital tools for cognitive assessment, especially TAPCAT. I'd like to let Verónica, who's part of our impact team, to tell us more about the session. She'll be the moderator for today's session. And she'll introduce Dr. Marcio Soto, who we've been working with for a long time. Thank you, says Veronica. It's a pleasure to introduce Dr. Marcio Soto, psychologist, graduated from San Agustin University in Arequipa, master's in cognitive psychology and neuroscience at the Complutense University in Madrid, and he's currently working as head professor in Sao Paulo University and San Agustin University in Arequipa. Dr. Soto is an active member of several scientific organizations, among them the International Society to Advance Alzheimer's Research and Treatment, and Latin American and Caribbean Consortium on Dementia, the International Neuropsychological Society, and the Latin American Society for Neuropsychology. His lines of research are focused on electrophysiological and cognitive phenotypes and assessment tools for populations with low resources. He's shared his findings in numerous congresses internationally and nationally, and he's published in high-impact scientific journals. He's going to share his experience today on the issue of digital tools for the assessment of cognition with experience in Arequipa. Cognitive assessment in context of low scholarity, and also standardization of the tablet-based cognitive assistant tool in rural and urban areas in Arequipa, highlighting the high sensitivity to detect mild cognitive decline, even in cases of dementia, compared to traditional measurements such as CRUDAS and others. Likewise, he'll also talk about adaptability and experience of use of this digital tool in primary care context. It's an honor to have his participation. Just before we start, We'll have a few minutes to answer questions. During the session, you can write your questions down under the questions option at the webinar. Welcome. Well, thank you so much for the invitation to the IMPACT team. Please confirm that you can see the screen. Okay, correct. Reading it correctly.
¿Están viendo la pantalla correctamente, por favor?
Sí, sí, se ve de manera correcta. Y solo para robarte
Yeah,
un
you can
minuto,
see it
Marcio,
clearly. Just to take another minute, Marcio.
recordarle a los asistentes que tenemos la traducción simultánea también en
And just to
caso quieran
remind
escucharlo en
participants that we
inglés
have
o
simultaneous
en español.
interpretation in case they want to listen to it in English or in Spanish.
Gracias.
Gracias, Vero, nuevamente.
Thank you.
Por la invitación.
Thanks so much for the invitation and for collaborating with the project, which is important for cognitive health in Peru. And basically, I wanted to present the experience we had with TabCat, as mentioned. It's a tablet-based application to measure cognitive capacity with people with low education, and this is finishing. We hope that this is approved soon, but we're going to share some ideas, some experience with this level. And so everything we have to analyze today, we always have projects, problems detecting dementia in countries such as Peru, in general, many countries in Latin America, or even countries around the world. It's complex to assess a patient with complex characteristics. For example, when the years when a patient is high in years, when the education level is low, we have that problem from the outset. So in research, we have the same problem. When people with a very high education, you need to adapt the testing, but sometimes that can mask some shortcomings based on and hence the experience of the test taker. But detection always can happen even with people with who may even be illiterate. Also, cultural obstacles such as, for example, culture. So, acculturation. So, for example, problems like asking someone, "Are you of Quechua or Aymara origin?" They may say no. Like if it's an indigenous people of Peru. Uh, However, in more familiar context, the person may admit and say and be able to admit that they understand Quechua or another indigenous language of Peru. We are a multilingual country, and so it's very relevant to understand with what's happening with brain health and mental health in our country. Plus, differences in sex, prevalences associated with greater frequency of participants or cases that happen in women, and the urban rural divide also, which is important for some testing, for adapting instruments for them to work. The problem is that we're always going to find this and the need to find those measures that are sensitive enough to try to control all of these aspects. That still is very complicated. So for that reason, there are many tests that have problems. So we have lots of tests, all the way from brief tests, but also with some kind of neuropsychological connotation, which is TAPCAT. But in both cases, both in brief tests, cognitive tests, or psychological tests, there are difficulties. For example, the floor and ceiling effect. The ceiling effect is large. A person with a high with a high educational level is always going to be scoring very high unless they're in a very late stage of dementia or have some significant change. And a person with low education is going to have a lower score because there are topics that are not properly validated, suited to them, ecological understanding and validity. And we started using these tests many years ago already, and we would always say, who copies cubes throughout their life? Few people. If someone went through formal education, maybe they might have done some of these things, but a regular mortal human being doesn't do that all throughout their life. So how do you assess? You use colors, use pencils. These are many things that we need to work with. Recommendations for many researchers, Miguel Arce, you have to run these tests in their native language. We like in the U.S., for example, they have many migratory problems. Of course, you have to use the speaker's mother tongue, but it's not always possible. And there's a huge etc. in the system. For example, with us, many of our participants who are migrants, for example, from Arequipa or Puno, Cusco, their maternal language is Quechua or Aymara. So, when we speak in Spanish, that can exacerbate some biases or problems. So there might be problems with fluency or other things. Plus, you also have the problem of there being, for example, certain domains like orientation, and there's a clear marker of domains that can be associated for one test or for another. So, what kind of test to apply or what kind of material to use is something you reflect on, and we try to find something that can meet all of these requirements and taking into account what the limitations are. So, when we talk about this neuropsychological, neurocognitive evaluation, these contexts or research, we have to think about these domains and go a little bit beyond the cognitive test. And again, it works very well in some cases. So in Peru, it's worked quite well, but the idea is to go a little bit further and to give some pathologists the weight they deserve, like memory, for example, which we know is affected in initial stages of Alzheimer dementia, in mild amnesia, decay. So some of these things can be optimized and also take psychometrics into account. For example, all of these domains, all of these ways of understanding the tests, which to detect these cases have to have that double component. Of course, that component centered on what's important, but also validity, reliability, clinical validation, which we did today, which we did now, and clinical validation, so that we have sensitive and valid instruments in our context, which is one of the things that historically we've had many difficulties with. Just to remind everyone, the Winthrop work on cognitive domains that can be affected in early stages and later stages in some demential syndromes, such as frontotemporal dementia or in Alzheimer's type dementia, we can see affects memory primarily. So memory is important without being the only factor, but in other lines of work, we're looking at visual spatial processing, some components of language that are key domains in order to understand the normal aging process versus the pathological aging process. And there's a source of domain in type. There's a mastery, for example, in memory that is affected in Alzheimer's. So the objective focuses on that, and to that end, we follow two stages. As we know, one is brief cognitive testing, and one that is broader. As I said a few seconds ago, the idea is to try to combine these things in order to arrive at a better detection of patients with initial deterioration or more advanced deterioration. In practice, it's pretty clear. We see patients that we have doubts about, and for patients where you have doubts, you have to be very careful with the tests you use. Many patients or a large group of patients arrive when they're already in more or less advanced stages of the disease, and detection isn't too complex. Obviously, ruling out other factors that could be affecting them, some more systemic deficiency, for example, that is important in a context of care, be it primary or higher, to look at possible factors that could be altering mental and cerebral health for our patients. And Of course, it's
Obviamente,
easier.
esta
This
fase
becomes easier
está
when the stage is
bastante
advanced, but the idea is to
avanzada,
detect this
pero
beforehand. Remember
mientras
that
esto se
the
detecta,
main
por
dementia,
lo menos lo que la
Alzheimer's, the
persona
first
piensa y no
manifestations start
sabe.
15 to 20
Y
years
hay
earlier.
ciertos
So
ejercicios
the idea
patológicos
is to
aquí que son
detect this
interesantes.
much
Entonces,
earlier with
la idea
sensitive
es
instruments that allow
detectarlos
us
mucho antes, algunos
brief
ejercicios
cognitive
simples
tests and
también,
then
y
neuropsychological
alternativas
assessment,
breves
but of
y
course,
evaluación
with a greater
neuropsicológica. Pero
focus
claro,
on the key,
más
on the
el
main
foco
aspect,
se
which is
hace
taking
en
these
temas
brief
donde
cognitive
básicamente
tests. And
son
like Aurelio Pardo
ejercicios
says,
cognitivos
I
breves.
always mention
Y
this,
como dice
the
Carlos Pardo,
ideal
que siempre lo pongo, el ideal,
is
lo
sometimes
ideal
well, the ideal is usually an enemy of
a
many
veces
things,
viene
but like
con muchas
I
cosas,
would often tell my
pero
students that
como digo a mis
in an
estudiantes,
ideal world there's no poverty, there's no
el
war,
mundo
et cetera, but we have
parece
to
que tiene
adapt ourselves to what there
guerras
is.
y un largo etcétera.
Okay, so Carnero Pardo mentions that obviously one has
Bueno,
to be
entonces
brief.
Carnero Pardo menciona que obviamente
A
tiene que ser
test, an ideal
breve,
test should be
en
very
el caso
brief,
ideal,
less than
bastante
5 minutes
breve,
in primary
y si no
care.
breve, en atención primaria no
For
necesariamente, si
specialized
es
care, maybe
complicado,
10 minutes or
una persona
less.
especializada dice
So that's very,
15
it's
minutos, 20
interesting,
minutos,
it's complicated. It might
más
be easy
interesante
or
o
simple.
complejo.
Remember that a brief
Fácil, simple, recuerden que el
cognitive test
ideal
should be able to be
es
used
tener
by
una
any
técnica
trained staff,
simultánea que pueda ser utilizado por cualquier
physician,
individuo,
general physician, internist, psychologist,
médico,
nurse,
veterinario,
etc.
médico,
So it has to be
psicólogo,
trained staff,
enfermera,
basically.
etcétera, ¿no? El asunto es que
Uh,
sea un personal entrenado, básicamente.
has to
Eso lo
be
vamos a ver en prácticas muy
useful for
correctas,
lower levels of education, preferably no pencil and
zoológico,
paper, and
etcétera,
it shouldn't have a
y no
cost,
personal,
obviously,
uso
in
uso
contexts such as
muy
ours.
interesante y muy
Now, from a
importante en
psychometric
contextos como los nuestros.
point of view, it should be
Desde el punto de vista
valid, what
psicométrico,
we've done with
obviamente
our
sea
tests.
válido, que es lo que hemos hecho con esta
Also, it has
técnica,
to be
que
reliable, sensitive to
esté
change,
una
etc.
teoría, que
Right?
sea
So, like,
fiable,
you have to have that, like the
sensible,
ceiling
etcétera. O sea, que
floor
muestre los
effect
hechos que
and
dice
not to be
básicamente
biased
y que no esté sesgado por
by
ninguna
education.
ideología.
And
Prueba ideal.
complex,
Compleja,
obviously, will as we
compleja de encontrar,
progress through
pero
research, we try
obviamente
to
como
find
vamos a
things that
hacer en
allow
esta
us
clase, pues tratamos de encontrar
to
aquello
get
que
that. And
resulta
to that end, well, having this context
Para
clear, we saw
ello,
that
puesto ese
there was
contexto, nosotros
this
vimos que había
using,
por
a
ahí
classic
pacientes
mocha or medimenta, but when we saw
posiblemente utilizaban
patients with,
moca,
uh,
pero cuando veíamos a pacientes con
we were
Parkinson,
having
muchos
patients
analfabetos se nos escapaban.
be missed when they had low education
Efectivamente,
levels.
sí,
So we
eso
needed to
es
do
bastante
more. We
tedioso,
needed
siempre
to
decimos
develop
que
some kind of
tenemos que hacer algo más.
additional test. We
Tenemos que
had to look
estudiar algo
outward to
más.
see what we had, what could
Tenemos
help
que
us.
hacer
And
pruebas
in that
experimentales que nos
process,
podrían ayudar.
we
Y en ese
TabCat
proceso
appeared,
aparece el TAPCAT,
among others, of course, among others. And
junto a otras, por supuesto,
obviously,
junto a otras
in the
pruebas
contacts and initial strategies, we saw that it could be quite good, 10 minutes,
vimos que podría ser bastante
very
bueno,
good for
10
detecting
minutos,
early stages, which is what
podría ser
interests
muy
us
bueno para detectar
for a
ciertas
demential
etapas
pathology. Could be Alzheimer's
de
or
una enfermedad
another.
demencial, como puede ser
Plus,
Alzheimer,
it's
puede ser
based
otras. Además,
on
está
a
basado
tablet. Like I
en
said,
una
it's
tablet, como
table
bien dice por ahí, es
tablet-based cognitive
tablet-based
assessment. It's called TabCat, right?
Cognitive Assessment
With
Tool.
several interesting dimensions such as
Como dice
memory,
Carlos, tiene cosas
executive function,
interesantes como
space processing,
memoria,
language,
funciones ejecutivas, visoespacialidad,
even social
lenguaje,
emotional in the later versions.
lenguaje
So it
social,
could be something
comunicación.
interesting. Plus,
Entonces,
uh,
podría ser algo
manageable
interesante
in a
y
complex
además
environment
manejable con un
uh,
entorno complejo
for people with low
de trabajo
education, where there's
representativo,
normally
donde
a lot of rejection to
hay
using pen
rechazo,
and
¿no?
pencil
A
and
usar
paper because
lápiz y
they're not
papel,
used to it. They haven't
porque
used it.
están acostumbrados y no
Plus,
lo han usado.
even if they went to school for a few years,
Además, por más que hayan ido al
not
colegio los
including
años, como es un
culturization,
fenómeno inclusive de
people
aculturación,
reject that. People
se
might have gone
rechaza
to school for a couple of
esa
years,
idea
learned a
porque
few
no la
things, but
saben
they may say
usar,
they
no la
never went, they
entienden,
know how
no
to
la
use it,
aceptan,
etc.
pero no es que
So
nunca fueron
it's
a estudiar,
complex.
etcétera,
So a
etcétera.
tablet
Es bastante complejo.
that's more
Entonces, tratar de
intuitive that
hacer
allows them to
información más
just
intuitiva, que les permita solo dar
uh,
este,
click with their finger. It's something marvelous.
exactamente,
So
darle clic ahí con
we
el dedo
decided to
sería
try.
cosa maravillosa.
Has lots of components.
Eso vamos a
It
probar.
has
Tiene varios componentes,
memory, which is a favorites
tiene
test,
tareas de memoria, que es
match, executive function
el
test, processing. We do a
la
lot of
parte
that.
ejecutiva y velocidad de procesamiento que usamos nosotros.
We obviously we
Tareas de inteligencia
have
visoespacial muy
uh,
interesante, un poco compleja,
improved
obviamente,
memory,
bastante
remembering that
complicada, que es parte del
memory has a
proceso.
codification, storage, and recover and retrieval stage.
Procesamos, fase de
So all
almacenamiento,
of
fase de
these decision
ejecución,
differences between storage or not
visualización, si
storage,
almacena o no almacena,
and
si
remembering that
memoriza
how
a
the
partir
patient or
de
subject codifies
simplemente que el
things.
sujeto codifique cosas, que pase un
The
tiempo y luego
test
las
wouldn't allow
recupere.
this to be done. And plus, in other versions, other
Y
questions, there
además
were
han
pretty good
agregado a estas
questionnaires, such
evaluaciones
as,
algunos
for
cuestionarios bastante
example,
buenos, por
the talk
que también genera
questionnaire,
validación por otro
which
lado,
allows us to see some
funciona la ILUMINA,
subjective
nos
complaints,
permite ver
executive
dificultades
problems,
cognitivas,
memory.
problemas de memoria, problemas
So,
ejecutivos y más cosas.
so it seemed to be an
Por lo
interesting test.
tanto,
Plus, we also
si eso nos
decided
vuelve a
to
interferir
compare
con
it
la
to the
prueba,
gold
además
standard
nosotros decidimos
and the Brutus,
compararla
which
con el
we have
rango
been showing over the
de,
last few
del Brutus,
5 or 6
que ha
years,
venido
basically,
mostrando en los
thanks
últimos
to
6
the
años,
works of
básicamente gracias a
Nilo
personas como Nilo
Custodio,
Custodio,
with
poblaciones que están
populations
totalmente
that are of
analfabetas y
low
demás,
education, and so we decided to contrast how the TABCAT
entonces
worked with these
decidimos
testing.
contrastar cómo funcionaba el TAPCAT con estas pruebas.
Just to mention a couple
Solo
of
para mencionar un
cases,
par de dos o tres casos del mismo,
uh,
de cómo está funcionando en el mundo.
there has
Por
been a
ejemplo, se
sensitivity
mostró
to
algo
showing
sensible para detectar casos de deterioro
cognitive
cognitivo.
decline in Germany, for example.
En, en Alemania, por ejemplo, este trabajo, de Tollers en Alemania.
For example, when you compare it
Por ejemplo,
to
comparándolo contra el MOCA, a ver cuán
Tor
sensible
Mocha,
es
here you can see
y
the compound
el,
score,
el puntaje
the
compuesto
BHA, which
del
is the
BHA, que es el Braille Health Assessment,
health
que es básicamente
assessment. It tends to be
evaluar
more
el
sensitive
aprendizaje,
than, for example, Mocha.
es mucho más
So
sensible
that's
y
very clear in
sensible
the
que, por
graph.
ejemplo, el MOCA.
And this recent
Por
work
ejemplo, este trabajo
Elena
reciente
had,
de Elena
that
Zoe
UCSF has shown
eh,
that if we
de
join
UCSF ha
them
mostrado
with
que además
biomarkers, then
de
they
low
become very
cognition,
sensitive
digamos,
compared to
indicadores, se ha mostrado
just the
súper sensible
biomarker, etc.
comparado
So,
con solo el
but you can see,
biomarcador,
I don't know if you can
etcétera.
see it,
Entonces,
plus the
aquí vemos
biomarker,
ustedes, no sé si logran verlo,
the
además del biomarcador,
compound scoring of the TADCAT and the
el
BHA,
compuesto del TAPCAT
and the
y el
social
BHA,
demographic changes. If
y
you put all that
los
together,
datos
it's simpler.
sociodemográficos.
Now,
Entonces,
obviously, it's more
básicamente
complex,
todo eso
but
es más sensible.
there
Por
has been
supuesto.
sensitivity to it. So we've
Eso obviamente nos interesa,
oriented the
sí.
study
Entonces, ese
around
por
that
un
way. I mean,
lado,
evidence
todo el
says that
código, por
TabCat
ese lado. La evidencia
works,
dice que
and
el
therefore
TAPCAT funciona.
we can
Por lo tanto,
try
tenemos
different
que comprobarlo
variables and so.
considerando además variables sociodemográficas.
And
Esto es lo que hicimos.
so,
Es un proyecto financiado por Glocal,
this
eh,
study
de la Universidad de
in
California.
the University of California was
Básicamente para
basically
detectar
aimed
sujetos con
at
deterioro cognitivo leve de aquellos
people with cognitive
cognitivos
decline and
moderados
those who go to
de demencia, que
dementia,
son un estudio de seguimiento
trying to
clínico.
do that.
Tratamos de hacerlo
Where we did this, we
para medio
ran
referencia.
this in
Básicamente
Arequipa, in the
decimos,
south of
estamos
Peru,
nosotros
very
en
close to the
Arequipa, hacia el
Andes,
sur del Perú,
the province in
cerca de los
Arequipa that I'm
Andes.
at recur
La provincia de Arequipa, que es donde estoy en este momento,
is
está a
2,300 meters
2.300
above sea
metros
level
del
in
Camaleón,
Camana
en
Conde
Isla
province.
Mujeres,
It's a little bit
provincia de
higher,
Loja.
2,700,
Está un poco
oh,
más, a unos
almost around
2.600
2,900 meters
metros,
above sea
igual a
level
unos 2.900 metros
for
sobre el nivel
better
del mar.
reference. It's very close to Colca Canyon, those who are
Provincia
from
muy
Peru.
cerca del cañón del Colca, aquellos que son de Perú.
It's a rural area.
Es una zona
We,
rural
and in Arequipa, it's more
lo
urban.
hicimos, y
So,
en Arequipa una zona más urbana. Entonces,
so some of the first studies,
los primeros estudios que evalúan a esta población
it's mainly bilingual Quechua
básicamente
speakers, and they
incluyen
speak Quechua and Spanish, and then usually L1 Quechua, L2
castellano,
Spanish. So all
L2
that assessment was done
L2
in
castellano.
Spanish. By the way, we
En este caso
use some
en Arequipa. De
examples of
paso,
instruments used.
utilizamos
We
algunos
used
ejemplos de los instrumentos
the test with
utilizados.
the favorite subtest,
Utilizamos
which is on
el
associative memory.
subtest, the favorite test,
Associative memory is
memoria
a classic
asociativa.
topic in
Memoria
neuropsychology.
asociativa es un tópico
We
clásico en
use
neuropsicología.
Western scales, associated
Hablamos de
pairs,
escalas de
and
memoria
tests of
clásicas
that
en
kind, where you basically
neuropsicología.
tell the participant you introduce
Básicamente
different
selecciona un
faces in
participante
this
y le
version.
presentan una serie de rostros en
It's
esta
different than the
región,
bird watch that has birds in
igual
context where they
en
live,
los
but this version
países
used
y en
faces,
contextos donde viven.
and
Pero esta versión utilizaba
it
un
was
test
associated with some
y
words for
se
they
asociaba a algunos
some known
conceptos
words. So, for
clave, como
example,
son
they
los,
were told you're going to see
por
faces
ejemplo,
and you'll see your favorite animal and your favorite
identificaron
fruit. So
su animal favorito,
there's
su
a
fruta
phase of
favorita.
codification where you
Entonces hay una fase obviamente de
show
codificación donde
them
se le
the
presenta
task and
el
the
código,
test.
obviamente,
And so
y el
you would
test.
introduce stimuli, and the
Se le
person had to
presenta otros
remember if
estímulos y luego la persona
that
tenía que
face was
interpretar
associated or not to that animal or to that
si el
fruit.
rostro se asocia
So
o
it's
no
an associative memory test
a
that's
esa
quite
fruta.
good.
Es una tarea de memoria
We
asociativa
also use
sencilla.
the match, which
Y
is
también utilizamos el match, que es
the test
es el test de función
speed of
ejecutiva y
processing
velocidad de procesamiento.
in
Eso también en neuropsicología. Ahí
SDM
presentamos el
test
papel de
is one that's
ILUMINA, por
validated in
ejemplo.
Peru.
El SDMT es un test que también está
Basically,
validado en Perú.
it's about looking at how the patient
Básicamente es
responds
ver
when faced with a number that appears on the screen and see what figure they associate that with,
con qué figura.
and
Es fácil darle
give them the tablet so they can see what they associate that figure
figuras
with.
asociadas.
It involves processing
Puede
skill, but it
generarse
also
del
involves
pensamiento, pero también puede
executive
ser por el poder
function.
ejecutivo al tratar de ejercer
And
cierto control inquisitor y
so
cosas.
in
Y
this
influenciará
case,
para este análisis en
uh,
concreto
some
que
all the
nosotros
animals they
llamamos
know, for example, or
clasificación
have seen
funcional,
for semantic
todos los animales que
fluidity.
conozca o haya visto, etcétera. Entonces,
So that's
básicamente se
pen and
llama
paper, and
lápiz y papel y luego se carga una serie
obviously
natural de
this
palabras y
is
después
something that is
se puede
automated
tomar nota del
and
asunto, por ejemplo, grabándolo y
and it's easier
poder
to process.
procesarlo más rápido.
So just to give some examples, I mean, but there are many other things. So
Algunos
for
ejemplos
what
aquí.
else do we find? First, we'll see some demographic
Primero
characteristics,
vamos a ver unas
analysis,
características
and
demográficas,
leadership on the article
análisis y la
by
liderazgo
Andrés
del
Muñoz
artículo
Nájar, our team in
firmado
Arequipa.
Andrés Muñoz Nájar del
We
equipo de
saw
investigación en
that
Arequipa.
there was
Vimos
greater
que
female presence than
había
before. We
efectivamente
had a
población,
greater percentage of people who lived in
teníamos un
rural
mayor
areas,
porcentaje
Camanaconde, for
en zonas
example,
rurales,
a
al
lower percentage in
campo,
Arequipa. And the first thing we did was
Arequipa.
use a broad
Y
protocol that
lo último
included
que hicimos fue utilizar un protocolo
neuropsychological
amplio que incluía baterías
process plus
neuropsicológicas,
CDR. And what
además
we
del TRAPCAT
did
y el
was
CDR. Lo que
categorize
hicimos
them through
fue
the
categorizarlos a partir del
CDR,
CDR,
which is a
el Clinical
clinical
Dementia
dementia
Rating, que es una
rating,
medida estándar
which
para
is the
evaluar
diagnosis we use for cognitive
consideramos este deterioro
dementia
cognitivo de demencia.
uh, decline, and use looking
Evaluando
at
un porcentaje
percentages
de casos de
between so
demencia
you see
leves y
using
severa,
cutoffs
demencia
for low
severa y una demencia leve.
for mild dementia versus
Lo
severe
hicimos
dementia.
porque los casos con
And
demencia eran
so the
bastante bajos,
percentage of dementia were low.
bastante bajos.
Uh,
Y el mayor
the
porcentaje de
average age
adultos, ¿no?
69 years old, and you can
Mayoría de
see
edad,
the years of
69
formal
años. Y
education,
vean ustedes que son medidos
3.44 with a variability of 2.21. So these are standards of what? 3.44. So we have lots of uh,
3.44.
people who are illiterate or who haven't finished primary school. So that was a great core
Fue nuestro
of the
gran
work, was
core del trabajo,
focusing on
fue
people who had a very low
estudiar
level
un
of education. Plus,
bajo
we
nivel
observed what
educativo.
we already knew
¿Listo?
in this first
Además observamos
analysis,
lo que ya sabíamos en nuestros
how
primeros análisis,
different tests are
cómo
associated. Let's remember what we
hicimos
saw.
diferentes
So,
pruebas
animal
con
association,
individuos y con
favorites,
animales, el favorites que es la memoria,
plus
que es
the
registración,
variables,
con
first plus
detenimiento de tiempos también con
MMSC and
edades,
RUDAS, looking at the
registración
variables also
demográfica.
and the years of
Entonces
education, you
nosotros
can
lo
see
que
something that
hicimos
will
es
get our attention
identificar
that
un poder cognitivo de
education,
demencia
it's
en 10
understandable
años de
that the more
educación,
education you
aproximadamente 2
get,
meses
the
estudiados.
higher the
2
score,
años de
but
educación,
it
un
didn't
porcentaje
show a
mentor,
significant relationship
pero
with
no mostró
memory.
una relación
Independent of the years of
significativa con la
education,
memoria. Independientemente de los años de
memory
educación,
goes on
la
its own. It's
memoria
pretty interesting.
pasó.
Not just the years of
Eso es
education, but also
bastante
age. It
interesante. No
seems
solo los años de
like
educación,
this
sino también la
test
edad.
can
Parece
be
que
sensitive
esta
enough in these
tarea
first
puede ser
analyses
lo
for that.
suficientemente
Then we
sensible
ran
para estos
regression
primeros
models
análisis. Luego hicimos modelos de regresión
to try to
con otros
understand
árboles
how these variables are
para
working. And we
tratar de
observe the
entender dónde
same
estaban las
pattern.
conductas
Years of
variables.
education have a big
Vimos un
impact.
patrón, los años de educación
Don't
importan
affect
mucho,
much.
por ejemplo, la edad,
Residents, urban areas, rural
especialmente en
areas do
zonas
affect. For
urbanas.
example, rural people had lower
Normalmente las
scores in general.
personas en zonas
There's an
rurales
impact
tienen
there, but not too much according to
hay un impacto
subsequent
ahí,
data
pero
because
no
additional
mucho
work
según
was
los
done.
datos posteriores, porque
It's
todavía estamos
important to
haciendo muestras
mention
adicionales.
that
Es
we
importante
base
mencionar
ourselves on
que
Lena
nosotros
Soy's
nos
work,
basamos en los trabajos de
who did
Lena
the work at
Soy,
UCSF,
que es la que
trying
realiza los
to
trabajos en
create
UCSF,
a compound scale,
tratando
one,
de
and two,
generar una
trying
escala
to
compuesta
normalize this data, meaning
y dos,
trying to
tratando de
find
normalizar
patterns that
esta
can
escala,
tell
es
us
decir,
that this
encontrando
person is affected or
patrones
is
que
not
indiquen que
affected,
este sujeto tiene
depending
afectación, este
on
sujeto no.
regression-based norms.
A partir de
What's
esto vamos a
important
trabajarlas en
about
regresión.
normalizing
Lo interesante de
based on
esto, por
regression,
ejemplo,
it
con la
means that
regresión es que
you need a
hacer
very broad
regresiones se
sample.
necesita una muestra súper amplia,
For general psychometrics to
masiva.
normalize data, you
Nosotros
usually
tenemos que
need
tratar de
enormous sets of data.
racionalizar
But in
datos.
these
Necesitamos
regression
muestras
models,
grandes.
these
En
norms
estos
based on
modelos de
regression, you don't need
regresión,
such a
nosotros
huge
nos basamos
sample.
en
And
la
that's very
regresión simple,
interesting
digamos, una
because
muestra
of how
simple,
complex it is to
relativamente
assess a
simple,
patient. So
porque
based
hacemos
on this, we
regresión
found the
con
following.
pacientes. Basados en eso encontramos lo
We
siguiente.
found that you have
Encontramos que
the
esta
tap
escala
cat
compuesta,
compound,
el
and
TAPCAT,
it's much
por
more
ejemplo, ¿cierto?
sensitive.
Es mucho más sensible y
But
específica
we find
de lo que
something
uno puede para
interesting.
detectar.
We
Primera
put the
observación muy
model, we
interesante.
put to the model
Nosotros pusimos
variables or covariables that can affect results, and we gave them a weighting based on that, on how it affected it or not. Age, years of schooling, gender, and where they lived were considered covariables, and there's a lot of statistics behind it, but we'll share that in due time so it can be read. And based on this, see if there is weight and see how sensitive that can be to detect or not. This first curve shows us that it is more sensitive, but in this first curve, considering a predictor without the social demographic variables that are usually heavier, like co-schooling, but all of these were included in this. And in this second curve, what we did was include only the variables that were significant. So only those that were significant and the capacity for TAPCAT to the the bright health assessment was higher com compared to root as a millimeter. So for this second curve, we considered just the predictors, uh, social demographic ones, and they showed us better sensitivity. This was very interesting because we shared this with using Z scoring. Remember statistics or psychometrics. Remember that Z scoring is the normal one for distribution. Hence, it allowed us to see how it could work. And that weight of these Z scoring would allow us to detect much more clearly and firmly mild cognitive decline vis-a-vis others. And then in this analysis, what we saw was run cross analysis on what the CDR was issuing as controls or for these cases. And then norms created based on this analysis, meaning on the weight of the social demographic analysis as far as scorings. And we grouped tasks of TAPCAT to create a compound scale and be able to create some categories that would allow us to see what cognitive decline there may be or whether there was dementia. And what we found was that when we ran this with all the variables or co-variables, gender, years of education, etc., there was with another standard that's CDR, we were able to see who had dementia versus who didn't. But when we added the co-variables that were significant, basically years of schooling, age, it made that sensitivity greater based on the TAPCAT rather than CDA. So it improved upon the standard, but it could improve sensitivity as we saw in the curves. Hence, we see a priori that the TAPCAT, this compound scoring of the assessment of the TAPCAT testing allowed us to detect cases of mild cognitive decline, preclinical phase of dementia, a strong propensity to develop dementia. Plus, with the points we had, we were able to show an urban sampling in Arequipa and help early detection in primary care context. But of course, there are limitations. I mean, there are different things to take into account. Clearly, I don't know. Uh, this is one of the participants in the lab in Arequipa. You see the face and their favorite animal, and you have to say yes or no. And I think it's quite applicable to the degree that obviously you're able to create certain adaptations and changes to the tests. So first, important matter. As a limitation is that the TabCat is based on just iPad, so it only works with iPad, right? Um, this and what is used mostly on this side of the planet isn't iOS, right, from Apple. We use Android here, so it's not. It's still in progress to be ported into Android. It's not there yet. It would help tremendously. So in these first versions, we had an online version, and we had to assess it and be connected to internet and load the data into the system. But at Cabanaconda, where the experiment was run, internet was terrible. It still is terrible. So in rural contexts, the connectivity is a problem. Then we were able to get an offline version, which was quite good. But at the end of the day, this was a couple of years ago. We had more things in it, but we would record the information in the tablet and then we were upload it whenever we could. And we had an important loss at some point. But at the end of the day, we were able to resolve the issue. And I understand that it's doing much better. The application is improving. Then how did people take the test? When we ran the test in Arequipa here in the lab, in general, there was great acceptance of it. It was just a matter of, I mean, our protocol had lots of options. So, oh, different tests plus TabCat. So we tried to get impact, and one important acceptance just was using just a hand. In general, it's something that where there is very little, sometimes they get angry and they almost break the tablet. They hit it, but it's part of the process. In rural areas, it can be more complex, but again, in a much more friendly, even playful context, participants can show great adaptation to using the tablet. Again, these are people who historically uneducated, basically with serious problems, even for language communication, non-native to Spanish, and so associated to acculturation. But we still were able to get a good context, and so the researchers who did this were impressive, and people who choose to participate, and we had a quite an extensive battery, and we were able to get these results. I think were very good to help them. But obviously, we need to keep advancing in this. We need to get more clarity as to how we can work with these compound scales. This what's been developed in the article. We're hoping it gets published soon. We need to work on automation and be able to, based on applying the test, we should be able to generate the scoring and get a base report that can be highlight patients at risk, patients without risk, things like that, that can allow us to then follow up. And that would allow us in primary care to address important information we don't have right now. We're talking about rural areas where the capacity for detection is very bad, very poor. Much data says that over 75% of cases are not detected for dementia due to these limitations. So we believe that these rules that we're working on with TAMCAT could generate, see, and identify patients at risk. So we believe that this digital tool can help us tremendously in detecting problems with dementia or mild cognitive decline in urban populations and in rural populations as well. Very well. Thank you very much. I want to thank the team that has helped us tremendously. Miguel Sanchez, who got us the sponsor for the University of California. Sergio, Natalie, who's part of the study. Milton Custodio, also grateful to Andres, who helped us with the analysis, and
que nos ayudó con toda la parte de
and
análisis
drafting written document, and then Nancy, who's here in the Arequipa team,
acá
leading
desde el
some projects that
departamento
have
en Arequipa,
helped us tremendously. And then, of
algunos
course,
proyectos que nos ayudan mucho
those who
con
helped us with
análisis,
assessment, Rosa
y
Tupac,
sobre
Tatiana
todo
Ibáñez, and
Verónica
Rosangela,
Investigación,
who
Rosa Tupac,
did
Tatiana Yáñez y
spectacular
Rosangela,
work,
que
especially in rural
trabajo
areas in Arequipa.
espectacular
And
en las zonas
obviously,
rurales de
some
Arequipa.
sponsors of ours for
Igualmente
projects in
a
Arequipa.
algunos
Thank you very
financiadores de
much.
los proyectos en Arequipa. Muchísimas gracias.
Thank you, Marcia, for the interesting presentation on this TAPCAT test. We'll see how. Now we go on to the section of questions and answers. Here we have a question. Do the results of this study have they resulted in studying an institution that maybe to use in MINSA or using other technologies? Excellent question. As you already know,
Excelente
well, this
pregunta. Como
study
bien sabemos, nosotros
is
este
the first
estudio
on this side of the planet doing these things.
de este lado del planeta
It's
haciendo estas cosas.
hard and fast
Es una
research.
investigación pura y dura. Hemos visto que
We
funciona.
follow
Esto es nuevamente
informing the
sencillamente
system,
hacer
the public
cosas
system
para
or the
informar
private
al
system,
sistema
and
público de
have this
salud
tool available.
para
We've
saber
had
si podemos usar esta herramienta. Hemos
rapprochements,
tenido
but
algunos
in general, we're
razonamientos
still
ahora en proceso de
many details still left to address because
conocer muchos detalles, porque obviamente
this
la
has a base in
investigación tiene
California. There have
base
even
en
been
California.
personal data
Y hay
transfer issues. There's a
otros
whole
temas de transferencia de datos
personal
personales, hay otros
information
temas
issue
de
we have to
pequeño, por
work on. We don't
ejemplo,
have the
claramente
technological
no
support
tenemos el
directly in
soporte
Peru, and
tecnológico
transferring data is a
directamente en
problem.
Perú, y esa transferencia
That's
de
one.
datos
And
es un
two,
problema.
the issue
Uno,
of
dos,
managing issues of public
arreglar y
health.
sincronizarlo en sistemas
We need budget
informáticos,
for that and
¿verdad?
other things.
No
So
necesitamos presupuesto para ello y otras
we
cosas.
want to try it as a
Lo
private
estamos probando, lo hemos
system and
implementado aquí en Arequipa
see
con
if it
nuestro
can work.
personal
But
y ver si
we are in
funciona,
conversations
pero
to do this.
estamos en
So
algunas
for the
conversaciones
moment,
para ver si mejora. Por el
that's all.
momento, no.
Okay, thank you very much, Marcio. I don't know if you were able to write some questions down. Or you can also raise your hand and then ask if need be.
Me imagino levantar la mano y preguntar. Eli levantó la mano, me parece.
I think Ellie raised her hand. Yeah, Diego Bustamante, I think also. Congratulations for the presentation. My question is, do you think that the cultural factor can affect CapCat?
Excelente pregunta, definitivamente sí, ¿no? O sea, una de las primeras
Definitely
cosas que
can. I
vimos es que
mean, one of the
nosotros
main things is that
utilizamos la versión argentina del TAPCAP, no la
we
versión
used
Perú del
the
TAPCAP.
Argentine version of TapCat
Entonces, y en general, como
because
ustedes
there
saben,
was
acá en
no
California
Peruvian
nuestros,
version. And
por
as
ejemplo,
happened in
la
California,
gente
faces are, for example,
entonces,
white
más allá de que la
people.
gente esté
And so,
expuesta a
in
la
addition
televisión y
to
otras
people being
cosas,
exposed to
a ello,
television and other things
siempre
exposed to that,
resulta
there's always going to be a certain,
no diríamos en este caso rechazo, porque repito, el
I don't
trabajo
want to say
de la
rejection
gente
because,
de
I
toda la
mean, it's
organización hizo un trabajo primero
the
muy,
team
muy
assessing the
analítico,
participants,
muy,
and it
muy
wasn't very
psicológico, de que acepten su información y
psychological,
luego
I
recién
mean,
evaluarla.
except they did a
Por
lot
lo
of work on
tanto,
getting
no
them
hubo
to
un rechazo
understand
como
things
tal.
before
Pero
uh,
sí hay mucha data
assessing them.
respecto a
But
que si puede
there's
ser
always an issue
diferente
with
porque
regard
puede
to
procesar
something
muchas
that's
veces
not
mayor y
very
por lo tanto sí puede
frequent.
demorar
Your
más en
processing time is
procesar
greater, and if
a
you're
un
taking
ritmo
more
más
time to
normal,
process,
así de
then it
sencillo.
takes you
Así
longer
funciona
to store.
nuestro
It's
cerebro.
that's
Entonces,
how
por
our
ende,
brain
por ese lado,
works.
por
So
supuesto. Entonces,
could it be affecting
el otro
things?
tema son
Yes.
animales más
Another
frecuentes,
thing
digamos, ¿no? O
is,
sea,
for
hablando
example,
de
more
animales y
frequent
frutas, tenemos más presencia
animals, like
de
animals or
aguajes
fruit that we
en la
have in
selva.
different
Y si un
regions.
aguaje, pues
If I go to the
necesitamos
jungle and they tell me about aguaje,
cierto tipo de
it's a
aguaje con
familiar
cierta
thing. But if
calidad.
I go to the jungle
Entonces,
and they tell me what
en una
aguaje palm
región
fruit
de
is,
selva
uh,
semi-urbana es un tema
so for the
completamente distinto.
jungle for
Cultural,
Peru,
multilingüe es una cosa total.
in a
Entonces,
multicultural,
tendríamos que
multilingual
trabajar algunas
context,
versiones
we
adaptadas,
would need
algunas
to
versiones que traten de evitar ese sesgo cultural,
work on
que en mi experiencia es bastante
avoiding
complicado.
cultural bias,
Digamos,
which
si
is
bien en
very
algunos casos
complicated.
son posibles,
To
se pensaba que lo visoespacial era
generally,
menos sesgado culturalmente, pero
we
en mi
thought
experiencia
that
es
even the
sesgado
spatial one would be
culturalmente.
less biased, but it
Entonces,
is biased
nada, es
culturally.
explorar, es ver algunas
But it's
versiones,
about
conversar
exploring. the options and
en California y ver si podemos hacer
and
las
talk about
adaptaciones del caso.
seeing if we could do these adaptations in California
Muchas gracias,
with the
Marcio,
California
Kelly.
test.
Creo que
Thank you very much, Marcio. Kelly, I think you had a.
Sí, fácil, no quería robarle tiempo a las preguntas
Yeah, I didn't want to
de
take
gente,
time
pero
from
sobre el
questions, but
tema de
just on the issue
el uso
of
de la herramienta digital, estaba
using the
pensando que
digital
había muchos
tool, I was
esfuerzos por
thinking that there
hacer
are many efforts now
digitalización o
to
si te los hacían adultos
digitize
mayores para que el uso de las
or
herramientas sea
working with
mucho
older
mejor para
adults to
ellos,
have the use
porque
of
también
tools
debe haber ese
be
tipo de sesgo.
more useful to
Pero
them because there must be some
quería
kind of
ver más o
bias.
tu posición
But
de que
it's
no
clear
había
now
habido
after this
ningún
position
tema
that there
de
had been
sesgo
no
del valor
issue
y
of
de
values
las
being
evaluaciones, porque
reduced
estaban muy
for these
abiertos
evaluations because they were very open to using them. So
pero entonces es antes de
then
darle la tablet a ellos,
before
hubo
giving
un
them the
periodo de que
tablet,
ellos
there was a period
familiarizaron
where
con el
they
iPad, porque además el iPad
became from
tampoco
like
es
were they
básico,
familiar with the
intenso,
iPad because it's also
grueso,
not that easy to
práctico y
learn to
difícil.
use. It's not
Sí,
so
sí, sí, tal
organic, I
cual.
would say.
Sí, como les digo, nosotros
Right, like I
las
said,
fases de evaluación eran
the
primero
phases of
muy
assessment were
entrar a la
first
comunidad y decirles que vamos a hacer una serie de
going into
pruebas
the
y después
community and
hacer la
then
utilización de estas
telling
tablets.
them they were going to run a series of tests and
Pero fue primero eso,
that
más
include the tablet. So it was that, and
investigación,
also
protocolo
due
ético,
to
y
pure
vamos, esto es
protocol
lo que queremos hacer
issues
y todo
to
lo que
inform
vamos a
them of
lograr y los
everything
beneficios
we're
que
going to
vamos a
do and what
lograr
we'll
si lo conseguimos.
achieve and
Entonces era un primer
et
acercamiento
cetera, et
bastante
cetera. So it was a
básico,
first
digamos,
approach
para luego
in this
empezar a hablar de rubros uno a
psychological
uno. Esto es investigación, por lo
test
tanto fue
thing
uno a
where
uno.
so it was one-on-one at
Y
first
con una curva de aprendizaje
and
porque todas las
with
tareas
a
tienen
learning
exámenes.
curve because
Entonces, si
all
no
tests have
funciona, tenemos que
examples.
volver
So if it
durante
doesn't work, we have to
hasta
go
que
back, then we have to go
funcione.
back until it
Entonces,
works. So
no hay una,
there is
no es
no
autoevaluado, por lo
it's
tanto, el
not
participante no entra solo
self-assessment.
con la
So the
tableta y hace
participant
sus
isn't
propias
there
cosas,
alone with the tablet
porque
there.
además
That you have to give them instructions
hay la
because
intención de que
you have
todo
the
puede ser
intention that
automatizado, sería genial,
everything
¿no?
might
Pero
be
la persona que entienda
self-administered, sure, but
vea ahí
a
los
person
escuche
who
las consignas y
sees
completa la
the
tarea, pero nosotros hicimos uno a uno
tasks and
y así sí
completes them,
funcionó. Entonces,
we
obviamente
give
que
them
eso
one-on-one
tuvo
task and that works.
frustración,
So
muchos participantes que se
again,
frustraron
for
con esto,
participants, a lot of them got
casi me
frustrated, of
rompes
course, a little bit.
un par de
They almost
iPads,
broke a couple of the
porque fue una carga
iPads.
muy fuerte, ¿no? Porque
I was
eso,
very because they kept hitting it
digamos,
hard. They were like, "It's this one, it's this
pero
one."
más allá de eso,
But I mean, beyond that,
eran pacientes con algún cuadro.
obviously these were
Algunos tenían
patients with
mucho
some
miedo
kind of
porque nunca habían tenido
situation,
una
or they
tablet.
were afraid too. Like
Entonces
they'd
tenían
never had an
miedos,
experience with a
pero
tablet,
nunca
so they
les
were
ocurría.
afraid to like
Entonces iban como
touch it, and we were like,
simulando
"No, don't
a
worry about it, touch it." And they would very slowly
eventualmente
approach
y
it
como cambia, toco y cambia.
and
Entonces
almost like
eso
like
da
touch it and
impresión, ¿no? Pero
change. And
claro,
so
cuando
that
íbamos
also
demasiado, a lo mejor
created
los niños
interference.
empezaban
But we tried to manage it
a
as best
quejarse
as
de la información y
possible,
etcétera,
and
etcétera. Pero bueno, esa es otra historia.
they told us to leave the tablets with them. But obviously, that's a different story.
Oh, muchas gracias, Marcio.
Oh, thank you very much,
Y
Marcio.
entonces,
And
volviendo a lo que
so,
acabas de decir,
getting back
mi
to
pregunta es
what you
tal
just
vez
said, my
también debe
question
ser el
is,
tratamiento a la hora de
what
responder
is the
ahí en el emprendimiento,
processing
porque
speed
realmente
when
tienen
connecting?
problemas
Because I
y
mean,
porque tenían más
they
miedo y se demoraron
sometimes
mucho más
it's
tiempo.
not so much because there's problems, but because they take a
Excelente
little longer,
pregunta
right?
o comentario. Por eso nosotros
A great question.
ponderamos las puntuaciones
We
por los años de
weight
escolaridad.
scorings by
Ahora, claro,
years
que
of
si tiene
school.
menos años de escolaridad,
It's
claro,
clear that
tu
if you have
velocidad es más lenta, tu
less
accuracy
time
es
of
más baja.
schooling, your
Pero las
accuracy is
puntuaciones finales
lower,
que
your speed is
tenemos
lower, but the
para este
final
estudio fue ponderado
scoring that we had was weighted
sopesado
to
por los
include
años de
for that.
educación. Y eso es creo uno
It
de los
was
logros más
weighted with
importantes
the years of
de
education.
este
I think that was the
proyecto y
biggest
de la película y del uso de la tablet. Entonces,
elements of
claro,
this project and
si lo
using the
traemos a
tablet.
contextos más
If
urbanos
we
o
bring
más
this to more urban
institucionalizados, vamos a ver
context,
eso
more people with more schooling,
mucho
you're
más
going to see
pero si
a lot more of
inclusive
that.
lo sopesamos
But
también por los años de
even if we
escolaridad,
weigh them
le
again
podríamos tener una
due to
medida sensible que sea
schooling,
independiente
you
de la
can have a
escolaridad.
metric that
Y eso
can
sería un
be
golazo. Ya, tras eso vamos
independent completely of schooling. That would be great if we could have that.
Muchas gracias, Marcio, porque además también
All right,
comparar,
thank you so much. And because
perdón,
we're going to
es
compare
como
also things,
comparar
compare
el desempeño que tienen en la tablet
the
versus
performance they have
en
in
la mesa,
the
la verdad
tablet
siento que están acostumbrados
versus
también, por más que esto
even
supongo que
even
también puede ser un
though
reto.
I suppose this has been
en
a
la
big
segunda parte
challenge
de
for you folks.
del trabajo,
Well, the
damos
second part of the
ahora
work, the analysis that's coming,
evaluamos con un protocolo súper extenso en neuropsicología,
we evaluated an
que incluye el
extensive
Free Q
protocol in
Selective
psychology
Reminding Test, que es
that
una figura
included,
clásica para memoria. Tenemos la figura de Rey, que es
we
clásico. Algunas
have the
variantes del
rake
TMT,
figure,
algunas pruebas
uh,
clásicas de velocidad de
some classic
procesamiento. Entonces ahora viene esa segunda parte,
Uh,
a ver cuánto se relaciona con esas medidas,
So we
algunas
need to see
validadas
how
actualmente.
you correlate to those
Digamos, por el
measurements.
momento
What's
como
valid and what's not.
neuronas,
We
pues
see
es
that right now
educativo,
some
pero
don't
pues
correlate with
es
education, but I think
pero
with
es
memory it'll
definitivamente
work
un
quite
análisis
well.
en proceso.
But that's part of the analysis in progress.
Genial, muy interesante. Muchas gracias.
Very, very interesting. Thank
Sí,
you very
ahora
much, Marcio.
precisamos
I don't
el
know if
tiempo para
there's any other question, if we have time for another question.
Bien, buenísimo.
I think with this, we can consider the session complete. It's been the first session, and we thank you very much for this, for being with us and for telling us about what you're doing in your team. And for us, it's great to have these networks and to get to meet people working in dementia for the well-being of our population. And also open to, in case there are any further questions or comments that you want to ask, that you want to give Marcio or any of our presenters, you can always write us and we can post a contact or send them the question directly, because that's the idea behind the impact, which is to join all of the ones who are working for the benefit of people with dementia, their families and their caretakers, so that we can continue creating this network of interinstitutional work, I would say. So, yeah, so thank you for your presence here. I don't know if Matthias was able to send the Google Forms. It's a last request for those who were with us today. There's a in the chat. There's a Google survey. A Google survey if you want to tell us about what you thought, so we can keep improving these webinars more and more. If there was any issue that you were interested in, or any panelists that you would like to listen to in the session. And yeah, so thank you very much for your time. Thank you for this hour that we've stolen from your afternoon. And thank you, Marcia. We'll be looking forward to the new results to invite you again. Don't worry, don't worry.
No hay problema. Gracias a
I
ustedes
have,
por apoyar el
you know,
desde
from the South, any support you need, you can count on it. Okay, great. Thank you very much, Marcia. And thank you, Vero, for
un abrazo.
being here, and the whole Impact team for helping us to create this series. Goodbye. Thank you. Take care.
Un abrazo.
Gracias a todos.
Thank you, Marcio.